The brain, despite its small size relative to the body, relies almost exclusively on a continuous supply of glucose to sustain its high metabolic demands. When blood sugar levels fall, such as during episodes of hypoglycemia, this energy flow is disrupted, putting neurons at risk of dysfunction or even death. Yet, in this fragile metabolic balance, one internal reserve offers a buffer: glycogen. Mostly stored in astrocytes, brain glycogen can be rapidly mobilized into lactate or glucose derivatives to support neurons during short-term glucose scarcity. But like many compensatory systems, this reservoir is double-edged, especially in the context of diabetes, where its regulation may be disrupted and its role turns more ambiguous, if not dangerous. In the healthy brain, glycogen acts as a strategic energy reserve. During brief periods of hypoglycemia or increased neuronal activity, astrocytic glycogen is broken down through glycogenolysis, producing lactate that is then shuttled to neurons. This lactate supports synaptic transmission, preserves ADP levels, and prevents excitotoxicity, a vital backup that helps the brain withstand transient energetic deficits. It's particularly important in areas like the hippocampus and cortex, which are both energy-hungry and sensitive to disruption. Thus, brain glycogen is not simply a metabolic relic, it's a dynamic reserve that enhances resilience under stress. However, in people with diabetes, particularly those treated with insulin or sulfonylureas, repeated episodes of hypoglycemia are not uncommon. Over time, the brain adapts in ways that can become maladaptive. One such adaptation involves alterations in glycogen metabolism. Some studies suggest that frequent hypoglycemia may trigger compensatory glycogen accumulation in astrocytes, an attempt to guard against future glucose scarcity. On the surface, this sounds beneficial. But this overcompensation may lead to unintended consequences. First, excess glycogen, especially when stored in aberrant or poorly branched forms, can be neurotoxic. Polyglucosan bodies, seen in certain metabolic disorders and increasingly in neurodegenerative conditions, are formed when glycogen is inadequately processed. These abnormal aggregates resist breakdown, disrupt normal astrocyte function, and may provoke inflammation or oxidative stress. If recurrent hypoglycemia prompts chronic glycogen buildup, it might paradoxically contribute to the very neural damage it's trying to prevent. Second, there's concern about glycogen blindness in hypoglycemia unawareness, a dangerous condition in which patients no longer perceive the warning signs of low blood sugar. The brain adapts to frequent hypoglycemia by increasing reliance on alternative fuels, like lactate or ketones, and possibly by tapping into glycogen more aggressively. While this may protect short-term function, it can dull the physiological alarm system, reducing the release of epinephrine and blunting cognitive symptoms. As a result, patients can slip into severe hypoglycemia without realizing it, risking seizures, unconsciousness, or even death. Additionally, the timing and localization of glycogen mobilization are critical. While small, targeted release of glycogen during acute stress can be life-saving, unregulated or poorly timed release might flood neurons with lactate or disrupt ionic gradients, particularly if the mitochondria are already impaired. For patients with diabetes-related microvascular changes or chronic oxidative stress, this metabolic surge may do more harm than good. The context of glycogen breakdown, whether in an inflamed, insulin-resistant, or energy-compromised brain, could determine whether it acts as a stabilizer or a destabilizer. On a more hopeful note, better understanding this dual role of glycogen could improve how we manage diabetes-related brain complications. Monitoring brain glycogen levels through advanced neuroimaging or metabolomic profiling might help identify patients at risk for hypoglycemia unawareness or cognitive impairment. Emerging techniques like 13C magnetic resonance spectroscopy could track glycogen turnover and give real-time insights into cerebral energy states. Interventions may also be possible. For instance, drugs that gently modulate glycogen metabolism or astrocyte function could preserve the protective aspects of this reserve while preventing its pathological accumulation. Lifestyle strategies like exercise and sleep regulation, which influence brain glycogen cycling and glucose sensitivity, could also be harnessed to support better brain health in diabetic individuals. In conclusion, brain glycogen during hypoglycemia sits at a delicate crossroads between rescue and risk. Under the right conditions, it acts as an essential buffer, shielding neurons from energy collapse. But in the dysregulated environment of chronic diabetes and frequent hypoglycemia, its management can falter, leading to toxic buildup, impaired alerting systems, and a greater threat of neurological injury. The key lies in maintaining balance, not just keeping blood sugar stable, but ensuring that the brain's own energy safety nets are used wisely, not wastefully. As research continues to uncover the fine details of brain glycogen dynamics, it may one day serve both as a therapeutic target and a metabolic marker, guiding us towards safer, more brain-aware care for individuals living with diabetes.